Okay, aloha kakahiaka kako. Happy Aloha Friday, everyone, and welcome to our Ola na ʻŌiwi Native Hawaiian Health Scholarship Program webinar series. My name is Nāpua Casson-Fisher, and I will be moderating today's panel. I work for Papaʻolalokahi, the Native Hawaiian Health Board, as the Education and Training Coordinator, and I have the pleasure of working with these wonderful wahine in their capacities as CHWs for the Native Hawaiian healthcare systems. You probably are more familiar with Lisa Ka'anoi. She's usually the person who welcomes people into the Ola na ʻŌiwi webinar. She'll be joining us later. But for now, mahalo again for joining us. The title of our webinar is ʻImaukea, CHW Impacts on Hawaiian Health. Just a few housekeeping. We started the recording of this webinar prior to you entering the room, and we will be sharing the recording with attendees of the registered attendees of the webinar, and I believe we're going to be sharing the recording on our Facebook, our Papaʻolalokahi Facebook. Down below, or maybe up above for your screen, you'll see that there's a question and answer feature. You can type in your questions if you have any throughout the webinar panel, or you can share it in the chat and we'll be able to bring up your questions later on in the webinar. For those for you folks who registered, you will be automatically included in the email reminders of future presentations. So if you're interested in attending more ono, is what we call this series, for short ono presentations and webinars, you will receive the notifications in your email. And after this webinar, you will be sent a SurveyMonkey survey. And so if you would be able to share your mana'o and your feedback regarding today's presentation, we would greatly appreciate it. And so we will get to introductions. Alrighty, first we have Kirra Tomori. She works for Hui Malama Ola na ʻŌiwi, the Native Hawaiian healthcare system on Hawaii Island, and her apana, or her districts that she cares for, is Hilo and Puna. She's been a community health worker for Hui Malama for almost just about 2 years this month, and she enjoys her work as a CHW because she can uplift many in her community, and most importantly, her Native Hawaiian communities. Next, we have Susan Oshiro-Taogoshi, and she's the community health worker for Ho'olalahui, Hawaii, the healthcare system, and FQHC, Federally Qualified Healthcare System on Kauai. Ho'ola's outreach program has expanded from MedQuest and SNAP assistance to offering, in the past year, COVID testing and vaccinations. She's born and raised on Kauai, and she's a strong believer in the old adage that it takes a village in approaches to create positive change. Susan is a volunteer at Hui Maka'ainana o Makana in Ha'ena, and she's a haumana of traditional practitioner Shan Chun, and she loves to paddle canoe. Aloha, Susan. And finally, we have ʻAtalina Pasi. She's actually the newest staff member for Papaʻolalokahi. She's currently the population health specialist and specializing in chronic disease. She previously was working at Keola Mamo as a community health worker for the Ko'olauloa district. She is passionate about protecting the quality of life of community members, as well as providing opportunities to increase the quality of life through health programs and other initiatives. Aloha panelists, thank you for joining us. We know that you're very busy, and so I'm very appreciative that you'll be able to spend an hour and a half with us and our attendees today. We're going to first go through individual presentations for each of our panelists. And they're going to share a little bit about themselves and the work that they do. And then we're saving about a half an hour at the end of the webinar to do some questions. And so if you have your questions that come up throughout the presentation, please jot them down or put them in the chat or the Q&A feature, and then we'll bring those up later. Alrighty, so we're going to start with Kirra's presentation.
So aloha mai, kako. My name is Kirra Tomori. Thank you all for joining in on this webinar. I'm very fortunate to be able to speak on this panel today and share some of the work experiences I've faced during my time. Mahalo nui to Papa Ololakahi for allowing us to have this platform to speak. So my presentation will consist of a lot of pictures. I believe pictures speak 1,000 words, and I want to share with you the many things we did during the past year dealing with COVID-19. So this is my wonderful team of CHWs within our native Hawaiian healthcare system on Hawaii Island. We all work for Hui Malama Olana ʻŌiwi. In the middle, I'd like you to know Chauncey. He is our supervisor. He previously covered our North Hawaii district, but is now the supervisor of our team. Adele on the left currently covers our North Hawaii district. Nicole on the left of Adele, she's a part of our National Association of Community Health Workers. Auntie Kiamalu with the beautiful papale, she's on the far right and she is our most seasoned worker and covers the district of Ka'u. Jovina next to her covers the district of Kona, and as you all know, I cover the district of Hilo and Puna. So our team motto that we use in our work, besides Hui Malama's mission and vision, is this motto here created by Auntie Pilahi Paki. With anything we do, with our work and our ohana, we will do it with aloha. I wanted to share with you all the first impacts of COVID-19 that we faced here on Hawaii Island. As an organization, we took action right away. I, as a community health worker for Hilo, transitioned to working from home. I was very fortunate to still have a job. My role and tasks actually got a lot busier, but it was more rewarding and fulfilling. We were able to bless our community and break down a lot of barriers. Our CHW team strongly felt that our community needed support, and we took action right away. We were tasked to reach out to our clients and community members to see what is needed within our communities. We completed a community needs assessment over the phone, and we were able to gather a lot of information and found that a lot of our community members face barriers. They were scared of the unknown, not knowing the outcome of COVID-19 and how long we would have to face this. As a community health worker, our job is to build these relationships amongst community members, and we're the ones they come to for guidance and the ones they trust. So this means we need to be able to provide the correct information and resources. And as you know, during COVID-19 at the beginning, a lot of the information changed rapidly. We always had to stay up to date. We attended regular webinars and meetings that were hosted by other community partners such as Hi-Fi and Department of Health and many other organizations. This allowed us to be able to share the right resources and information throughout our communities. Another impact that we face due to COVID-19 was quarantine and social distancing. In our culture here, we are so close to our ohana and communities around us. We love to gather together. We honi and hug each other to say hi. And we also had to pause on our home visits, which was hard for me and our clients. This took a major toll on our Native Hawaiian communities, which led to many hardships. Some of the hardships that we faced due to COVID-19 was a shortage of supplies, medical supplies such as masks, PPE, gloves, and also sanitization supplies such as sanitizer, disinfecting wipes, and spray. Another hardship was unemployment, and we are still recovering from today. There was also food disparities, and COVID-19 also took a toll on our mental, spiritual, and physical well-being. So this was our first event that our team went out to into the community after COVID-19. We assisted Auntie Jessie from Ka'u Rural Health Ku'u Rural Health Community Association. So she created this event to provide information to community members and residents of Ku'u, featuring Lieutenant Governor Josh Green and also our previous Mayor, Harry Kim. It was an honor to assist with setup and breakdown. We did check-in, temperature checks, and passing out resources and makana. It was also refreshing to be back out into the community. So one of the programs that we created as an organization to break down these barriers within our Native Hawaiian communities is the Malama Keola program. With the help of community partners, organizations, and community members, we were able to create care packages specifically to uplift the physical, mental, and spiritual well-being during this pandemic. We also provided face masks, shields, gloves, and sanitization. We were able to distribute 1,500 care packages island-wide. Of course, this would not have been possible without the help from partnering organizations and community members. So I want to say thank you again, mahalo nui loa, for all the help with this program. We continued to break down barriers and did more outreach. We did food distributions, continued our health education programs like Malamana Keiki, where we distributed backpacks of school supplies and diaper kits. We also participated in feedings at churches. We promoted the census. We also continue to provide more resources, information, and more information about our services here at Hui Malama. Our next task force that we did was partner with organizations such as Bay Clinic, Hilo Medical Center, Department of Health, Ku'u Rural Health Community Association, and Hamakua Kohala Health Center, and we participated in the island-wide vaccination pods. We assisted with registration, sanitization, traffic flow, promoted our health education services, provided more resources out to the community, and completed health screenings. Here are some of the photos of each vaccination pod throughout each apana. So this is the Hilo and Puna apana, the ones that I cover. The Hilo apana participated with Hilo Medical Center, and they hosted it at the Edith Kanaka Ole Stadium. So in the orange shirt, that's Elena Kabatu, and she was an amazing worker. All of the staff and all of the volunteers there, it was such a great experience to be a part of. The Puna Apana was hosted by Bay Clinic at the Muku'u Farmers Market, and they were so welcoming there. We actually got to take a tour of the farm, the community farm that they're creating there. So this is our North Hawaii Apana, and this is hosted by Hamakua Kohala Health Center, and it was in the Honoka'a gym. And I must say this one was so organized. I was very impressed. This is a Kona Apana, which was hosted by Bay Clinic at Miloli'i Fishing Village. And it was a very good experience to be a part of. We got to work alongside with Kimo Alameda and the Senator Kaikahele. So it was good to be down here. This is the last Native Hawaiian fishing village here on Hawaii Island. And then Ka'uapana, it was hosted by Bay Clinic at their facility, Bay Clinic Ka'u Family Center. They also had another one out in Ocean View, which was partnered with Department of Health as well at the Ocean View Community Center. So it was an incredible experience and honor to be a part of all of these vaccination pods. We worked together, laulima, as they say, many hands together make light work, and we were able to uplift and impact our Native Hawaiian communities. So I wanted to share with you all some of the services that we offer here at Hui Malama Ulana o ʻiwi. We have a family medicine clinic providing primary care, mental health counseling, nutrition counseling, and then we also have our health enhancement program that provides educational health management classes for diabetes, hypertension, chronic kidney disease, and nutrition. We also have support groups and exercise and fitness. We have traditional Hawaiian healing classes and also medical transportation. Please feel free to check out our website at hmono.org. So we currently continue to find the needs of our Native Hawaiian communities and just completed an island-wide community needs survey. We had a goal of 500 from our CHW team, and as an organization, we exceeded our goal and completed 714 community needs assessments. We are so grateful for the feedback from our communities, and we will continue to make positive changes within our organization on health improvement. So last, I would like to share a quick recap of the amazing things we get to do as community health workers. So I just want to say mahalo nui to everyone viewing this webinar and also to Papa Ololokahi for allowing us to share behalf of our organization at Hui Malama Olana o ʻiwi.
Mahalo nui, Kirra. That was such a great presentation. Gives us a really good, view into your world this past year. Okay. Our next presenter will be Susan, and she's going to be sharing with us her work that she's been doing on Kauai.
Aloha, sorry, no PowerPoint and slides. So I'm Susan Oshiro-Taogoshi with Ho'ololahui, Hawaii. I was initially hired here in 2013 to help with the marketplace. At that time, it was the Hawaii Health Connector. And since then, we've grown. And in this past year, was very difficult and challenging for everybody. And this year, Dr. Kapono spearheaded along with Dr. Berryman, who's our Department of Health head here, to start vaccinating our unsheltered population. So due to COVID, the Kauai community opened up 5 encampments, our shelter-in-place encampments, and that's where we had our unsheltered people congregate and live. So we had 5 identified on Kauai with over 400 individuals living on Kauai at these encampments. And Dr. Kapono and Dr. Berryman were very concerned about the cohabitation and living together in their living in tents. And so they started to talk about how we can help provide sanitation products to them. And so Department of Health, Ho'ololahui, Hawaii, and Malama Pono started to go out and provide COVID testing. So I have a medical background and was able to provide COVID testing or offer COVID testing at each campsite. We also did hygiene kits. We provided face-to-face, of course, social distancing, education. We brought out nurses, we brought out volunteer doctors to help us there. And we were able to provide over 2,000 kits from generously donated by Papa'ololokahi Department of Health, as well as our dental association here in Kauai. We also branched out into providing vaccinations at these campsites as well. So we were able to vaccinate a good population of our homeless residents there. And like everybody else, we are just collaborating and trying to find our way into this. And sorry, I don't have everything with me. I have everything all over my desk right now. So our shelter-in-place camps started to close down in March. And so we've now been assisting and shifting gears to helping them with housing applications, HUD and TBRA, and just finding a safe place for them to be at. So the barriers we've had during COVID were, of course, government offices that were not accepting face-to-face clients. And they ended up coming to Ho'ololohui, Hawaii. And David luckily allowed us to assist face-to-face social distancing. And we had to help them navigate the unemployment. We had to help navigate the medical, the MedQuest. So we have all these teams working together to help provide what the barriers and the hardships that our people are facing right now. So we have a wonderful collaboration with Department of Health, Malamo Pono, as well as our DHS office and other organizations to help out with the hygiene kits. And I think that's all I have.
Mahalo. Let's see. And then we have ʻAtalina. ʻAtalina will share with you folks. And then we'll have our Q&A.
Okay, can everyone hear me? Yes, okay. So aloha, my name is ʻAtalina, and I have been a community health worker for Ke'olamamo since 2019 November, and I was blessed to serve and to help the Native Hawaiian communities of Ko'olauloa and the North Shore. So here I have a Hawaiian saying. It says, "Ehele me ka pu'olo," which means make every person, place, or condition better than you left it always. So this is just my definition, or what does it mean to be a Native Hawaiian community health worker? And when I thought about that, the following themes came to mind. So the first one is Hawaiian history, culture, and tradition. In order to serve Native Hawaiian communities, you have to be willing to continually learn about Native Hawaiian history, culture, tradition, and understand where they are and work with them where they are now, if that makes any sense. So I am of Tongan descent. Both of my parents came from the Pacific island of Tonga, and they came to Hawaii in search of education. And when they came here, they decided to stay and raise their family here. And I'm so blessed to be in Hawaii. Hawaii is not my native land, but I've learned that to live in Hawaii is to learn about the history of Hawaiians, to know where they came from and their traditions, and to understand the colonization that has happened here. And with that, I moved to social determinants of health. So in order to help a community, you have to understand all of the social determinants that affect their overall health, and that leads to health disparities and equity. Speaking from my experience in Ko'olaloa, very underserved, not that many resources, but if you work hard and you create collaborative partnerships with organizations, identify the needs and let those needs be known to those who are in positions to help, who are in, such as our representatives. Our representative for Ko'olaloa and North Shore is Sean Kinlan. Our senator is Gil Riviere. Our councilwoman is Heidi Tsuneyoshi. So these are all key players, and I've been so blessed to be able to sit down and have discussions with them about what the Native Hawaiian communities they lack or what they need in order to improve their quality of health. And then empower, sustainability, and educate is what needs to happen within Native Hawaiian communities so that they can sustain themselves and be able to go out and work and continue healthy lifestyles, to educate and prosper within the communities such as Ko'olaloa. COVID-19 efforts. So COVID-19 started in March. I remember March 22nd, there was like a big shutdown. So the first thing that came to my mind is that our people need food and resources because everything shut down, especially our kupuna. Kupuna were the most vulnerable during the pandemic, and we wanted to protect them and to make sure that they were staying at home so that they could be healthy. So the first things that we did was we had food distributions. I just went on Google and I Googled food. How can we get food? There was Hawai'i Food Bank, but then we needed paperwork and we needed to go through the Department of Health in order to set up food banks in order to partner with them. And that was gonna take like 6 weeks, but we needed something like quick and now. So I was able to find Malama Meals, and Malama Meals, they were able to make hot meals for our community. And it was our very first, and we were able to partner with Polynesian Culture Center because they shut down, they let us use their parking lot. So this is how their parking lot looked. And we gathered anyone and everyone for the community. And when you put it out on social media, everybody comes. Everybody wants to help. So we had so many volunteers from the community that came, and I think that was one of the best or most rewarding experiences, is the coming together of communities to take care of each other. People sat in line in their cars waiting to get food, and it wasn't like it was a 5-star meal. It was like one piece of chicken and some rice and some salad, but they were so grateful always. There were never any complaints. We were able to get donations from our local egg farm. They provided eggs. We had the Lohui Foundation, and that's one thing that I found very important, is to empower grassroots organizations to take care of the community. So in Ke'olomamo, we have one community health worker that's assigned to an entire, so I'm assigned to Ko'olaloa, the Moku of Ko'olaloa, as well as North Shore. So that's 33.1 miles of coastline, 33.1 miles of rural communities that need help. And it's hard. I'm only one person, but I found that looking for these grassroots organizations and working together, like once you teach them how to go out and find resources, they go out on their own and they do they do whatever they can to help the people, because that's why they're there. They're there because they have a great relationship with the community, and they know, and the community trusts them. We have, from our very own community, we have the Tonga sisters. So while people are waiting in their cars, they were able to entertain. And this is just all of the food distributions that we had. It was like back to back every single week. It's so tiring. You gotta go out, gotta set up all of the barricades to weave in and out the cars. You set up the tents so that the food doesn't spoil in the sun. You put up on social media, we need volunteers, we need volunteers. And people always come. It's tiring, but when you have something to serve the community and it's a good cause, Akua always helps us all the time. We always start with a pule, we end with a pule. We're grateful for all that we have, and I know that Akua always supports and makes paths for us to achieve his work and to feed communities. We had food drives, we had diaper drives. We had Mother's Day food distribution. We were able to partner with Salvation Army, Alaska Airlines, Waihatsa and Company, just so many people coming together. We also had mobile efforts. So one population, actually two populations. So the kupunas, some of them didn't have transportation and were able to come out to our food distributions. So we were able to organize mobile food distributions to drive out and deliver directly to their doorstep. We also thought about our homeless communities. During the pandemic, they closed all the beach parks, yeah. And that's where our homeless communities would go and take shower. And so because they closed the community, we were able to partner with Project Vision. And Project Vision has Project Hie Hie, which is their mobile showers. The Church of Jesus Christ of Latter-day Saints and Sunset Christian Church, as well as the Ha'ula Community Association, were able to give us 3 different locations to have these mobile showers every Friday. So they would start from Sunset Beach, they would come to Kahuku, and then they would end in Ha'ula. So the purpose of these mobile showers was to help combat the spread of COVID within our homeless communities. And it was the perfect way for us to do case management with homeless populations. So we set up the mobile showers, and then we would set up a tent with like supplies. We asked the community, and the community came through. They donated towels. We had one community organization make a hot meal. And when our homeless brothers and sisters would come, we would ask them, oh, do you guys have insurance? And some of them would say no, so we'd fill out MedQuest applications. Oh, do you guys have SNAP? And they would say no, so we'd help them with SNAP. And it was a meeting place and a gathering place where we would come one Friday, we would come, fill out the applications. The following Friday, we would meet them again to follow up on if they've received any mail. It was just very beautiful. We also had care packages, and we'd like to thank Papa Ololokahi for providing the hygiene kits. Keolamamo had donated bags and all of the incentives, the pillboxes. We had community organizations donate sunscreen. And then Keolamamo had keiki toothbrushes for the keiki. This is the Kupuna mobile food distribution. So we just called on everybody that had trucks to come, and we would load them up, and we gave everybody a list, and we split it up. So one truck would be in charge of like 3 streets in one community, and then the other trucks would cover the entire community, look for kupuna. We had kupuna on the list, but we had so much food, so we were just knocking on doors. And I remember there was a a question in our that we were given in our email of what has been the best outreach effort. The best outreach effort has been door-to-door knocking. Social media, you miss people. Flyers, you miss people. But when you go each street, knock on doors, you meet families, you know where they live, you're able to talk story with them. So that has been the best way for me for outreach efforts. So we also focus on holidays because holidays were difficult because of COVID. Families didn't have jobs here in the Ko'olalo area. Our main employers are the Polynesian Culture Center, Kualoa Ranch, Turtle Bay, and the Marriott. And they all, these are all tourism industry companies. So when all of those shut down, families didn't have much for the holidays. So I was able to push all of these programs within the community, and they were so blessed and they were so grateful. This is our Mother's Day distribution. And then COVID vaccination efforts. One thing that I noticed was that the first tier of the first tier was kupuna to get vaccinated, but you had to go online and you had to sign up for vaccinations. And kupuna don't know how to navigate through the internet or devices. So what we did was we had a drive-through. The kupuna would drive through like a food distribution, and then we would take down their information, and we had iPads and we would register them for their COVID vaccination. It was a great way for kupuna to get their appointments. We were able to follow up with them, and a lot of the kupuna in our community were able to go to Castle Medical Center and get their vaccinations. And then these are just the pods that were brought to Ko'olauloa, the vaccination pods. 500 shots. I think the other one was 483, almost 500 shots. But it was so successful. And the Department of Health and the NHPI 3R team were just amazing in working and helping us to get the word out. So all of the COVID efforts, outreach efforts, getting to know the community, when disaster hit Ko'olauloa and houses were flooded, everybody knew each other. We had communication lines. We knew how to work together, and we knew how to get resources out to the community. So when disaster hit, we were already experienced. We met at the Hō'ula Community Center, and we did what we knew how, which was to help. So they set up at the Waialua Community Association as well as the Hō'ula Community Center to help all of the families that were affected by the floods. Hō'ula Homestead Road, the water came straight from the mountain and was just washing houses down and just flooded the road and flooded their yards. But we had names of volunteers. We knew who to call, and our volunteers knew what to do. We were able to rub shoulders with Kai Kahele, and different senators from all over the island came and they donated and then they helped. And so grateful for all of their hard work and the coming together and unification of community. I was also able to do a housing needs assessment to see what the need is for rental mortgage assistance, eviction prevention assistance, rapid rehousing, and the need was high. So currently, I'm helping Huia Hō'ula with the City and County of Honolulu's rental and utility assistance programs. And so many people, when they come to us, they're like, oh, you know, I don't think I'm gonna qualify. But we give them hope and we tell them you have nothing to lose, apply, apply, apply. And so many families have already received assistance. So many families are approved and awaiting their assistance. So I would just like to thank everybody for your time and attention. And It has been the best years of my life to be a community health worker for Keolamamo. And although I'm no longer a community health worker, I'm working with Papa Ololokahi, but it's become a lifestyle. You see people at the store, they need help and you just gotta help them. So I encourage everyone to take the community health worker certification courses. They're amazing. They taught me a lot of skills and tools that are so useful in helping and providing assistance for the community. Mahalo.
Mahalo, ʻAtalina. Thank you three for sharing about your work on your respective islands and for your systems. There. Now we're going to move on to our question and answer portion. So if you have any comments or questions, please put them in the chat or the Q&A feature. I've been able to work with the CHWs of the systems for however long I've been working at POL, a few years, and their way of working and their outreach and their compassion for the community is not something that was just, that came during COVID. It's something that that's instilled with them for a long time, and it's very motivational and motivating, and they are just always so humble and resourceful and innovative, and I love working with them. So thank you for sharing your stories. We have a lot of questions, but let's see. We'll start with what can health providers, what can the health providers that you work with or your health systems do to help you do your job, or to assist you in doing more outreach in community, or addressing the needs of your community? What do CHWs need, I guess, is the question.
I can answer this one. So for providers, I would say just being flexible and working with us as well. Put the patient's needs first, and just working as a team to get what this patient needs or this client needs. Because we do home visits, we are there, we build that relationship with the patient and client. And like for me, I work well if someone else in the medical office is advocating for the patient as well, and we can communicate together to make sure that this patient gets the coordinated care that they need. But that's really what it is, just that relationship.
Suzanne or ʻAtalina, you have anything to add?
Can I add something? I totally agree with Kirra. David has actually gotten us a really awesome grant to help our unsheltered patients, and they are Ho'ola patients. And we are providing them cell phones so they can do telehealth where they are. So they don't have to come out and travel into the community, try to get the bus, try to get their transportation needs met. So they're, and our docs are really accommodating with their telehealth visits. So that's been really awesome.
I agree with Kirra. Providing flexibility for CHWs is one thing that I think is very important.
Let's see, during the pandemic, what are some of your greatest challenges or greatest benefits that you faced over the year? Challenges and benefits in serving your communities.
Can I go? Our challenges were being grounded. We were grounded. We weren't able to do home visits or face-to-face visits from March, during March. And then Dr. Kapono and David allowed us to eventually start our face-to-face visits in May. And I think that was a huge challenge because many of them don't know how to use technology, and their unemployment wasn't filed, their medical benefits were terminated. So lots of barriers there. So
I agree with Susan. Technology was a huge barrier, especially with Kupuna or rural areas that don't have the service or connection to internet. A lot of people didn't have devices, so it was very hard to connect to our clients. We at first did the old-fashioned way. We mailed things to our clients. We talked to them over the phone, and then we gradually got into technology. So now we're doing televisits and DocuSign. So all of that really was a challenge, but it also turned out to be a blessing because it helped us to advance more in the technology realm. And I feel like it helped our organization along with community members as well.
I agree. One challenge for me was having to stare at a computer screen the whole day or just call people by phone. So I would just drive to their houses and drop things in front of their doors or at their mailbox. Some of my kupuna clients, they're hard of hearing, so telephone didn't work. We had to be creative and find other means to communicate and to provide care and services for them.
Kirra, you mentioned, well, everybody talked about technology, but on Hawaii Island in particular, internet access seems to be a really big issue. What were some ways that, that you helped your community access technology, even though you had a hard time with internet?
We would have to meet in, or they would have to go to places that would allow the internet access even till this day. So it was very hard to reach them. In the meantime, we just did mail and phone calls, but now that we're starting to do more home visits, it's easier. So just bringing the technology to them is a great benefit and what resolves a problem. Other than that, it's very hard, especially in the rural areas, to get into that and bring the technology or have them access technology. We just have to bring it to them.
We have a question in our Q&A. Each of you serve vastly different communities. In communicating the importance of traditional health and healing to providers, what have you found works best? I'll start with Susan, since you work closely with Sean Chen.
let me read that question again, sorry. So with our providers, what we did was Sean actually meets with all of our providers. He's part of our leadership team and part of our traditional Hawaiian healing practices here. So Sean not only works with our medical providers, he also works with our behavioral health providers. And for us, the referrals are all done word of mouth, and providers are great with doing referrals.
What about at Hui Malama?
So we provide a lot of programs with traditional Hawaiian healing. The classes are free if you register. So what we do here is we have them attend the classes and register, but we also notify their providers by sending out referral forms, just letting them know the programs that each of the clients have been attending with us. But it's really up to the client, and we try to do what's best for or what they need as wellness.
So for Keola Mamo, we have a Lomi Lomi program, and it's amazing. Everybody loves it. So what had happened was we have Kuku Medical Center, we have Ko'olalo Health Center, we have Kaiser, and we have Adventist Health Clinics. So the packet, the Lomi Lomi packet or application that you're supposed to fill out, for some reason, all of the physicians in all of these clinics had the packet, and they were having their clients who needed pain maintenance filling them out, and they were just sending them in, which was a problem because our community health workers are supposed to sit down with patients and fill it in with them. But instead, I was getting faxed, like already completed packets. So it's been amazing. The providers know the importance of traditional Hawaiian healing. And they're very supportive of the Lomi Lomi program because as physicians, the best thing they can do is give advice and counsel for diet and for medication. But traditional Hawaiian healing, it covers holistically body, mind, and spirit with Lomi Lomi. And yeah, very supportive.
Mahalo. Any other questions here? No, wait, okay. We do have some comments. Mahalo for sharing your wonderful experiences and doing this important work, my ka'i. And thank you for all of your work. Thank you for the session. Okay. Oh, are there any specific strategies or services you folks implemented during the pandemic that you hope to continue to use in your work as CHWs? Let's start. Yep, go ahead, Kirra.
I can go. So one thing that we did as an organization is we moved all of our educational classes online. So I really hope that we are able to continue this, and as long as slowly, gradually into in person, but we were able to reach out to vast people, even different islands and mainland, and even other countries reached out to attend our services. So I hope that we get to stay with the online route or online classes.
Yes, I see and seen lots of Zooms that Hui Malama was doing, the Zumba or the exercising one. Ikaika was doing a lot of the traditional healing workshops. That was really my ka'i. Well, the CHWs on Kauai, according to Susan, never stopped working. They didn't really work from home. You guys just went through. Is there anything that you hope to carry forward in recovery and past COVID?
I still like doing face-to-face. I don't, online is great. Our community is small and we're the honi and the hugging everybody. So I like the face-to-face, which we've been back to. So like I said, we were just grounded for half a month in March and we're allowed back to help our community face-to-face. But our fitness classes and our registered dietitian, we have online classes that a lot of people have been taking, as well as the nutrition classes. We have Sharon De La Pena, and she's our vegan expert. And so they've been doing lots of nutrition classes along with Sean. So that's been going great.
One strategy or service that was implemented during the pandemic that I'm a professional at is food distributions. But I would, right now, I am helping Huio Ha'ula help the community to be sustainable. So we're looking at farmers markets to support local farmers, and for this to be a way for Native Hawaiian communities to use public benefits such as EBT to purchase whole, fresh produce from local farmers within Ko'olauloa. I think another strategy or service would be, let's see, just connecting community to resources. I always post on Facebook, and I've had a really good following, and people are always telling me how grateful they are that I posted, because there's no other way that they're able to know about these programs, these assistance opportunities for their ohana. Everybody's always on Facebook, and it's been very effective.
Okay, Donna's question. Well, Papaolelo Kahi puts out every week the updated numbers of positive COVID cases. And over the past several weeks, Native Hawaiian numbers have been creeping up past Pacific Islander numbers, past Filipino numbers, past Caucasian numbers. So now we're pretty high and above by at least a couple of 100 positive cases. So the question is, if you know if the systems are doing anything in particular to encourage vaccinations for Native Hawaiian clients, or what kind of outreach or education do you folks offer in maintaining physical distancing, or how to still socialize but safely? Susan, you want to go?
Yeah, I unmuted and then I was thinking about the answer. So as far as vaccination goes, again, Dr. Kapono, and we also have an e-house specialist going out into the community and doing face-to-face education. We have Department of Health actually knocking on doors, and Ho'ola and Malama Pono have been actually going out into the community doing pop-up vaccine clinics at places like Kamakani. For us, our Native Hawaiian population vaccination rate is low as well. And it's vital that our doc gets out there. He's very well respected and they tend to listen to him. So I think that for us, that's been really huge.
I'll add on to Susan. I agree with Susan. A lot of awareness and education is the importance to encouraging vaccinations. Along with the vaccination pods, I noticed with Bay Clinic especially, they made it to where it's a happy event. It's not anything scary. They removed the worries. They had other donations from like Tokunaga store, which is a famous fishing store here, and did prize giveaways or provided bentos. And we were there, of course, to pass out more makana and provide health screening. So it was more kind of like a health fair rather than, oh, I'm just registering for this vaccination. It removes all of their worries. So that's very important.
And for our North Shore community, Waialua all the way to right before Hau'ula, our numbers for vaccinations are rather low compared to the rest of the state. ʻAtalina, was Keolomamo doing anything specific to increase numbers?
So not exactly. We didn't have anything to increase numbers. However, I did encourage and just share and put out all the webinars that were going on to educate and just put out all of the opportunities that are available within Ko'olalo and North Shore, which aren't as many as that are in Honolulu, but that's one thing that we need to improve on. I know that when vaccinations came out, there was a huge spike and there was webinars, there was education, there were flyers. I think that that momentum has slowed down, but needs to be reignited. The Delta strain is something that the vaccinations don't fully have immunity against, which needs to be shared within communities. And that's why we need to keep our masks on, and we need to push social distancing is still very important. Washing your hands, using hand sanitizer when you're not close to a water faucet. So I think we just need to keep educating, promoting, and putting the opportunities to receive vaccinations out there.
Let's see. Are there any, it's kind of like a, a policy question. Are there any policies or initiatives that you'd hope that your representatives or senators or council people could focus on or advocate for to improve the quality of life for your communities that you serve, or Native Hawaiian health systems in general? Start with you, ʻAtalina, because you already mentioned about government officials.
So I guess just an avenue by which communities can advocate for the things that they need, such as in Ko'olauloa and the North Shore, we need a dialysis center, but it's collecting the data, the numbers, in order to prove that it's a great need within the community. So maybe educating the community and advocating for what is needed within the community, that they may be able to sustain themselves and receive the resources that they need.
I agree with ʻAtalina. I strongly believe education is key to be able to advocate against leaders and to bring up their case. But one thing I just want to say is just for them to be open to listening to what the community needs, having an open door policy, and just being able to be open. Yeah.
I think for us, it's truly having an affordable place to live where people working at Walmart can actually afford their rent or their mortgage. So if we can have just affordable housing versus these $1 million mansions coming up on our island.
I agree with Susan. In Kahuku, for instance, we have developers coming like every month with proposals to build affordable housing for Ko'olauloa. The one currently, they want to build on ag land, but agriculture, land is for agriculture. It's for sustainability, food security. It's finding a way to work with city officials to use the land that's already been allocated for residential and making that affordable for our people. And that's 100% affordable, not a development where only 41% is affordable and the rest are at market value. So those are the types of issues at stake within Ko'olauloa. So many multi-generational homes, yeah? You have grandma, you have grandkids, you have mom and dad, all living under one roof, like 5 families, but it's because we cannot afford. Prices go up for homes, but the wages that we get paid are the same. And I've been hearing we're getting priced out of paradise. It's not paradise. These are homes for Native Hawaiians. These are their lands. And they should be living on it.
One of the current issues regarding community health workers in Hawaii is that the work that CHWs do in their systems or their federally qualified healthcare systems is not reimbursable by health insurance. So in the legislature, there were a few bills that were brought up to get that process going, to get CHWs not certified, CHWs reimbursed so that it's a more sustainable job for the healthcare system and the CHWs. And so one of the first, I guess, steps to achieving that goal is to have a statewide recognized CHW certification program, so that CHWs go through a program. Sometimes it's accelerated, like during COVID, I think it was only like one semester and a summer's worth of schooling, and then the individual would receive their certification. But there's also the 1 year program, which recently ʻAtalina and Kirra completed their year of program from the Maui Community College. And Susan also received her CHW certification a little while ago when the program first started. And so hopefully when the legislature gets on board and more planning is done, that we can get that going for CHWs. But for the certification programs, what were some valuable takeaways or skills that you gained during your time? I see that some CHWs have lots of life skills and experiences that is really valuable in their services that they provide their clients. But was there anything in particular that you learned in your program that's been helpful helpful for your outreach for your communities? ʻAtalina.
So one thing that I learned in Celine's class is about photo voice. Photo voice is the use of pictures, and a picture's worth 1,000 words, and it has power. So I remember showing them a picture of the elementary school in Kahuku and this huge turbine in the back. And like, they were just, like, you hear about it. You hear about like the wind turbines in Kahuku, and there were protests, but it doesn't register in your mind until you see that picture. Like, this is where keiki go 8 hours, 5 days a week to learn. And then you have this monstrosity in the back of the school. But photo voice has been something that I found very useful within community association meetings, meetings with stakeholders. A picture with explanation can be very powerful in enlightening the minds of those that you meet with to understand the issues within a community. And then I just wanted to share about policy. I was thinking that every single clinic or doctor's office needs to have a community health worker. And this is why. I am a community health worker in Ko'olauloa. There are 4 clinics. All the clinics refer their patients to me for social services, which is overwhelming. So I feel that there should be policy where every single clinic, every single physician's office needs a community health worker to help navigate their patients through resources and services that are available to them, instead of having Native Hawaiian healthcare community health workers cover like an entire area because there's no one else.
I agree with ʻAtalina. But also what I took from the education, we do the work. So it was very refreshing to get a structure, to get it out of the textbook and then refine our skills and be able to use new techniques that were actually a lot easier to do our work than to do it the way that we were doing it. So one skill that I benefited from the schooling is counseling skills. Being able to ask open-ended questions, letting the patient speak for what they want, just basically directing them to them resolving their problems rather than me putting what I think is best for them. It's more about what they think is best for them. So I gained a lot out of this schooling, and I highly recommend for anyone to take these courses. And I just want to say thank you to Papa Ololokahi for sponsoring us and funding us to go to these classes. It was really worthwhile and I'm very fortunate for that opportunity.
I agree with Kirra. The counseling class is the best class. You learn so many effective communication skills. Like for me, for instance, I would have tutus, aunties come into the office and they talk story, and I don't know how to stop them. I don't know how to be yeah. So in the communication area, the counseling class was amazing, and like Kirra said, it helps us help them to know what to do, to solve their own problems, and in that way they're able to then be sustainable.
What I learned from my CHW class was I have a writing reflex that I need to taper off and put my biases and ideas aside and use open-ended questions and motivational interviewing skills, which I am working on. And I love that ʻAtalina brought up the photo voice, because we did do our photo voice projects, and actually 2 of our projects got resolved. So one was with our crosswalks being repainted, and the other was actually fixing a huge pothole where the crosswalks were. So that was really huge.
We have not a question, but a comment from Donna that's the more of a reason for CHWs to be reimbursable, that private practices are challenged to cover overhead costs and rely on community agencies to assist. Okay. Well, I'm on my mind is going towards hurricane preparedness, because that's the season that we're in right now. And you all serve very different communities. And so I was wondering, as a CHW, how do you help to prepare your communities to be prepared and to maintain their safety during this time? And I'll start with Susan, because you work with so many unsheltered, especially recently.
Yes. So we still partner with the DOH. So we have a great collaboration with them, and they actually come out with us and do outreach or give us packets, as well as samples of like buckets that they can pack all their things in. So that's been really huge for Kauai, and loving that partnership with them. So.
I'll go next. Something that Hui Malama did, we got a donation of emergency kits just recently, along with an emergency preparedness checklist. So it was very beneficial for the clients. But what we were tasked to do is each community health worker in each apana had to take the emergency kit to a client that is in need or that would benefit from this kit. So what we're doing is just educating our clients along with staff as well. In our last staff meeting, we had a emergency preparedness meeting about what to do for our own ohana and kupuna. But yeah, that's what we're doing here.
For Keʻolamama and Ko'olaloa, there's a inter-island resilience network, and they do a lot with emergency preparedness, disaster relief, and it's all across the island of Oahu. And I was fairly new to this network, but they encourage ham radio certifications, because they say that once you're in a disaster, the most important thing is communication, communication throughout all of the communities to see what the needs are and how everyone can work together. Emergency preparedness as well. Ko'olaloa does not have, I think the North Shore as well, but we don't have like a emergency shelter. I think the emergency shelter is within the tsunami zone and a flood zone that we currently have, but that's all we have right now. So just pushing and letting our representatives know that we need an emergency shelter for hurricanes. And yeah.
Let's see, we have a few more minutes. Does anybody else have any questions in the audience? Did you folks want to share any last thoughts to the panelists? Maybe one question. For people who are interested in becoming a CHW, what is some advice that you could give them?
Kauai needs a CHW class again.
I would say just educate yourself on human resources. Attend the CHW classes if you can. But it's really just your heart. What we do is it takes a lot of heart to go out and help people. So it's just having that heart to get yourself out there and put yourself in areas that need service. You can do it, and anybody can do this job. But yeah, that's what I recommend.
One thing that I found successful is to be where Native Hawaiians are and to be the voice for Native Hawaiians. So all of the community associations within my area, I'm always there. I think our representatives are tired of seeing me, but I'm always there to listen to what the needs are, to what the issues are. And at the end, there's always community announcements, like they have 10 minutes. So I'm famous for jumping on the community announcements and saying, aloha, my name is ʻAtalina, I'm from Kealamamo. I'm the community health worker. And it's constant, like clockwork. I just introduce, and go to all of these meetings where I know all of these people will be. And that's mainly how I'm able to connect, be familiar and trusted within the community that I serve.
Okay, we have some questions. With all that you do and all the communities that you serve, what are some ways that you self-care?
I can go. So I love paddling, so that's my thing. And on Kauai, we were able to resume paddling. But my thing is working in the lo'i and cleansing there, as well as providing kalo to whoever needs to, whoever wants it and can come down.
What I do for self-care would be just spending quality time with my ohana. And I like to be at the beach too. That's my way of cleansing from everything.
I would say the same as Kirra, spending time with my ohana. And it's funny because usually my ohana is there at the food distributions and that's our ohana time. But just making sure that they know that community work, instilling that within my kids, like the love for community and the love for service, it's really helped me raise my kids. And my self-care is just making sure that I put my family first and I make time for them.
Going back to the CHW program, Donna asked if there's going to be a next session. So KCC, Kapi'olani Community College, has been maintaining their CHW program, year long for many years. So I know that they are continuing to offer that. I'm not sure if they're doing the accelerated version. I don't know if they're going to continue that on past COVID, but they will be continuing their regular coursework. And for the Maui Community College, they also are continuing their program. Papaʻololo Kahi is planning to support another cohort in this next fall 2021 session. I think currently all the CHWs, well, majority of the CHWs in the Native Hawaiian healthcare systems have all completed their coursework. And so we're going to be identifying some community members who are doing CHW work already that are interested in increasing their skills in that way. And the last question is more of a personal kind of question. How will each of the panelists grow in the next year? What's in your future? So do you have any goals that you're aspiring for? Any changes that you're going to be making?
I'll go first. One thing that I want to do is just continue on my education more in the medical field, maybe become MA certified, just so that when I get into home visits and I meet with clients, I have more skills in that area. And I still want to continue to service our Native Hawaiian communities. So just being out there in the community, finding what the community needs and servicing them as best as I can.
Susan?
So I do have a medical assistant certification. So I was really happy to be able to put that to use, offering COVID testing and then now actually doing the vaccinations at our pop-up clinics. So that's been really exciting. So I don't know what the future holds for me with Ho'ola. I'm hoping that we can continue to grow and look for more challenges and get over barriers that we are facing here with our community.
So for me personally, I am at Papaʻololo Kahi, and it's such a blessing. And I'm so grateful for all that Papaʻololo Kahi has done. And I'm grateful to be working in such an amazing organization that has been super active, powerful, and making changes, not only in Native Hawaiian communities, but communities within Pacific Islander communities as well. So my role now is population health specialist, and more specifically chronic disease. I saw something, I read somewhere that there's going to be a health equity office in the Department of Health. And that's something that's really appealing to me, because equity is something that we need within Native Hawaiian communities in order to improve quality of life. And I hope to work closely with the Health Equity Office and to be able to define health equity within Native Hawaiian communities. And it's going to be different with every Native Hawaiian community. I want to focus on diabetes. Diabetes because diabetes is prevalent within my family. 5 of my father's siblings have died within a 5-year span from diabetes, type 2 diabetes. And it's something that could have been prevented. And it's a pain and a loss that I don't want any Native Hawaiian family to go through, because it can be prevented. So that's my passion, making sure that ohanas are together and healthy and able to live healthy lifestyles and strive within the communities that they live in.
All right, I think that was a really good question and answer to end on. Thank you folks for joining us and carving out some time in your day to present. And I didn't really give you that much notice. I asked you on Tuesday, so mahalo, extra mahalo. And as a reminder for the audience, If this was your first webinar, then you were automatically added to the email list for future presentations. And after the end of this webinar, you're going to be sent a survey, or a survey will pop up. And so we appreciate your mana'o. And oftentimes the topics for future webinars are collected from these surveys. So we would love your input. And if you aren't able to complete your survey at this time, then a follow-up email will be sent to you. And so with that, mahalo again. I hope you all have a great weekend, and see you at the next webinar. Aloha.